when I reflect back at the last year and a half since I joined HealthiestYou, the first thing that really jumps out at me is growth. We've just had tremendous growth over the last year and a half. Matter of fact, year over year, we have grown over 600%. We were rated nationally as one of the fastest growing, 1,000 fastest growing companies in the United States. We've added many, many employees, and we're excited and thrilled at what's coming on with us over the next couple of years, finding all these ways, and we'll talk more about them in detail, all these ways to lower their medical expenses. And what an exciting, rewarding business to be in, knowing that we're saving people the kind of money that we're saving them. And so that's exciting. And Scott just talked about the open enrollments and all of these messages that are being reinforced by employees to us every day is just awesome. And I think the last thing I would mention that's helped us grow is our pricing. With scale comes efficiencies, and with efficiencies comes better pricing. And so there's no secrets. Over the last year, we've become more and more competitive in our pricing, and so we're excited to be able to bring such a great value to our customers at such a reasonable cost. And so I think if you combine all those things, that's what I think about this past year. It's just been a tremendous year, and we are certainly looking forward to working with all of you into 1/1 and into next year. So again, thank you for joining us, and Scott, I will send it back to you.
Great. Thank you so much, Pat. Appreciate that. Well, let's get into the HealthiestYou overview. So for those of you that have joined our presentation here today, and this is your first learning about HealthiestYou, we appreciate you joining. So let's walk through this real quick. So HealthiestYou, at the end of the day, what we're focused on and what we want to do is we want to reduce health plan claims by making healthcare easy for people. Now, we like to run a couple of parallels with some other companies that we've all heard about, because there's some interesting things happening in business today, things that are happening. We all may have heard about Airbnb, Air Bed and Breakfast. The largest accommodations provider owns no real estate. Facebook, the most popular media owner, creates no content. Uber, the world's largest taxi company, owns no vehicles. And HealthiestYou, we're known in the marketplace as the healthcare consumer engagement company that's driving down costs and redirecting claims. We don't own any clinics. So it's all about consumer engagement. We're that first platform that shifts consumers from those inefficient healthcare endpoints and confusing healthcare endpoints by placing the member right in the center of their options. Number one, we're going to meet you at your comfort level with technology. We all understand you've got those employees. They might have a smartphone, but they don't have any apps on there yet, right? They're not really technologically advanced. That's okay. We've got an 800 number for them. They can pick up the phone, dial that 800 number, get connected with a physician, and get their issue taken care of. But for those that are embracing technology, maybe they have the iWatch, they got the handheld devices, the smartphones, the tablets, we've got the apps going on there, the basic website access for the consumer interface. We're moving to the smart TVs right now with our couch care initiative. You come home, you're not feeling well, you're laying on that couch. All the TVs sold today are smart TVs. They connect to the internet. They got apps on them. This is where everything's going. Fire up the HealthiestYou app, connect with a doctor, check your medical deductor, maybe find a provider. It's all right there on your TV. We have all the connectivity on those touch points for those that like technology. So what are we offering on our app? Well, we're bringing in the most commonly used components of healthcare, and we're making it accessible and easy with the click of a couple of buttons on your phone. You can see where your deductible stands with your health insurance, because most people, you ask them on the street, they don't know where it stands. You can price out procedures. Your doctor says, look, you need to have an MRI done. Well, what's that mean? How much is that, right? I'm on a high deductible. Am I going to pay $300 out of pocket or $3,000 out of pocket? You can find that with just the click of a button. You can locate providers for face-to-face visits. Let's say you've got to take your child to a pediatrician for that well visit, but you don't have a pediatrician yet. We'll use our app to help you find the right provider for you that's in network based on your health insurance coverage. Of course, we've got our doctor network that's waiting for you and your employees and your members, instead of your members waiting for the doctor. We have board-certified physicians, 24/7, 365 availability that can take care of over 70% of your healthcare needs right over the phone or video camera. We have our prescription savings pricing tool. We get rave reviews on this. It's one of the most popular features we have. It's real easy. Type in any medication. We're going to shop that at a cash price and find the best deal for you. And guess what? 7 out of 10 times, it's going to beat your copay in your health insurance plan. If you're lucky enough to have a copay today, there's a lot of folks out there that have high deductibles to hit for pharmacy medications. So there's a lot of out-of-pocket expense for them. Our pharmacy tool makes it easy for you to find the best prices on medication. Now, our doctor network, this is one of our Trojan horse products for driving down costs within your company. We just had a big health plan partner of ours that ran an analysis on HealthiestYou for their members within their plan. Every time someone used HealthiestYou, it saved that health plan on average right at $300. So imagine that. Every time your employees are picking up that phone and calling HealthiestYou, there's massive savings to be experienced. So we want them to do that. They can go and visit a doctor virtually for over 70% of their healthcare issues. Be safely handled right over the phone. This report here by Deloitte & Touche, you might have seen this. It was in the LA Times and a bunch of other publications. We're going to do about 800,000 consultations via telehealth in 2015 as an industry. Well, their prediction is, in just a few years, that will be as many as 300 million e-visits. So this is shifting rapidly. At some point, we will quite possibly be doing more phone and video consultations for acute issues than we'll be doing in-person visits. Just makes sense. It works, it's cost effective, it's time effective, but the data is very, very clear that this is coming. It works, it's safe, and it's just ramping up. So our goal here is claim redirection. Okay? We all know we've got primary care, urgent care, and emergency rooms as options right now for care. They are costly, they're time consuming. Many times they're filled with germs. Sometimes you walk in and you see all these people hacking around you and you're saying, oh my gosh, am I going to leave with something worse than what I came in with, right? We know the claims involved, it's limited availability on times. It's simple. We teach people, go to HealthiestYou first. We typically make that free for the employee, just a PEPM fee. They can access HealthiestYou as many times as they want. And again, on average, you're going to see about that $300 savings out of your plan once they use that. When you combine the cost of primary care, urgent care, and emergency room visit, there's huge savings there. So the top 9 reasons we go to the emergency room, they're almost identical to our top 9 reasons that people call HealthiestYou for a consultation and get that issue taken care of. So imagine the waste that's happening in emergency rooms right now. If you're an admin in a company and you're contemplating HealthiestYou, you got to have this. Otherwise, your employees, they're going to be going into the emergency room for things like allergies, bronchitis, earache. This is all being taken care of as we speak right now with our doctors, over the phone with our members, resolving that issue. So let's get rid of that unnecessary waste in the plan. Our telehealth doctors are all board-certified physicians. They're all U.S.-based. This is not a call center overseas. These are U.S.-based doctors that are practicing face-to-face care, and they're doing telephone and video consultations as well. They're trained to diagnose, treat, and prescribe over the phone. We have the largest telehealth network in the country. This is 24/7, 365 access. Yes, we have testimonials coming in on Christmas Day, right? Getting connected to a doctor, getting that medication. We're live in 48 states. Idaho and Arkansas are the only 2 states that are on temporary holds. Idaho will be coming back online 1/1 at the latest, possibly December 1, with our new video technology that we're rolling out. We're redoing our complete video solution right now. It is awesome, super cool. It's coming back online very soon. When that happens, Idaho will be live because they went to a video-only state. Arkansas got very positive feedback a couple weeks ago from an email. Looks like they're going to be turning that back to where they're going to be accepting telehealth back in Arkansas. They just had to change some verbiage in their medical boards and the like to accommodate that. So my prediction is very, very soon we'll be back to all 50 states live. Here's the member experience. Very simple. 3 ways to connect to a doctor. You can connect on an 800 number. You can connect on one of your apps, your handhelds or your tablets or your smartphones, or online via the web. We take in your medical history. We route you to the appropriate doctor depending on the state you're in. The doctor reviews your medical history and then is connected to the member. If a prescription medication is suggested by that doctor, that's sent to the member's choice of pharmacy via e-script. Quick, safe, secure. It's ready when you come in to pick that up. Doctor updates the EMR with the notes, and those notes are stored in the HealthiestYou member portal for you to access, share with your doctor, reference as needed. Survey results. So what are the employees saying about HealthiestYou? Well, we call it the first use syndrome at HealthiestYou. You use it one time, the light bulb goes off. It completely changes how you think about healthcare, how you resolve your issues. We have a 97% customer satisfaction rating. I'll put it this way. I have 4 children and a spouse. There's 6 people in my family. Our doctor visits have gone down by 75%. We go in for well visits. Everything else is done over phone or video. So you can imagine how that can impact the cost of healthcare as we replicate that message, get HealthiestYou in the hands of the people, and increase the productivity and efficiencies of healthcare. 94% of our calls are resolved with no further action needed. 9 minutes is the average callback time. This is faster than you can get dressed, call your doctor, try to set an appointment, start driving to that urgent care center or emergency room. You're on the phone, you're doing a consultation with the doctor and getting your issue taken care of. 13 minutes is the average consult duration. We have a 95% client retention. That's, again, we're in open enrollment season right now. We're coming back. People are renewing HealthiestYou. They may switch the health insurance carrier out. They may tweak the plan a little bit, but HealthiestYou stays because it becomes the center of the plan where the employees are accessing their care first. Our average consultation fee, $0. We take that financial barrier away for the employee, price it out on a very affordable PEPM fee for the employees, covers the whole family, everybody has access. Now let's take a look at the technology real quick. So I'm going to sync my phone up here. I want to remind everybody, feel free to use the GoToWebinar control panel. There's a little questions box there or a chat box. Feel free to use that. Type your questions in there. We're going to get to those questions here at the end of the call, and we'll address those. So feel free. Now hopefully you all can see the iPhone 6 Plus here. I've synced up to the screen. I've got the HealthiestYou app live. If you can't see that, chat, let us know. But hopefully all good is with connectivity here with the app. So the first thing you do when you download the app, it'll walk you through a little tutorial. It looks different than this. It's going to ask you a few questions, show you how it works. You can sync your health insurance plan. So put in your health insurance provider and then your group ID from your health insurance card in your purse or wallet. And that's synced up, and it will show your deductible and help you find providers and the like. Now, when you first drop in, you'll see our little shortcut here. So if you want to just consult with a doctor quick, you can click that button, and it's going to take you right in. Confirm the phone number you want to be called back at. So when I hit request consult, my phone's going to ring in about 3 seconds. Personalized message comes on. So Scott, thank you for calling in. We're connecting you right now to the Caroline representative team. We're going to get all that information on the intake, get you set up with that doctor visit right away. Real easy to do. Now you can come back to Radar here. This is going to take a second to load. So we're at the HealthiestYou headquarters here in Scottsdale, Arizona. That's the red dot on the map. I'm going to zoom out. I'm going to load more providers in on this. You see our little circle spinning there. What's this doing? This is the Uber of healthcare. It's not cabs and black cars and SUVs, but instead it's healthcare centers. Narrow the search. Click on the stethoscope. These are doctor offices around you that are in network. Maybe you got to schedule that well visit. Maybe you want to find a new primary care doctor or a primary care doctor, because 72% of us in this country don't have a primary care doctor. Click on this button here. You see details. This is Greyhawk Family Practice right down the street. I want to learn more about that. First thing it's going to say is always call to make sure they're still taking your health insurance. It always is changing. This practice may have said, you know what, I'm not taking that now today. I'm switching. So you always want to call to make sure they're still in your network. We always remind you of that. You'll see the merchandising up top here, telehealth. Our doctors are always waiting. We know you're looking for a doctor, but this is something basic like, you know, bronchitis or pink eye or whatnot. Just connect. Let's take care of it right over the phone. We're always going to remind them about HealthiestYou. Now, if you still want to continue and look for that doctor here, we've got good information, 4.5 out of 5 stars here from Better Doctor. So they're looking at malpractice history. They're looking to see if there's any issues on the licensing side, right? Are the licenses up to date? This doctor happens to rank in the top 20% of doctors nationwide. So you get a little bit more content. You go to your health insurance provider, you'll have a bigger list of providers, but you won't have as much details. You'll have phone numbers and addresses and the like. This, we're going to layer on some other good content here and help you make that decision. What are the office locations? With that little green button, you can dial in with the background, where did this particular physician go to school, what's their specialty. We're just making it easy to keep you in network and find that provider. Maybe you want to find an urgent care center. Just click the Band-Aid. Maybe a hospital, right? Click the cross. The pill, pharmacy locations. The little dog here on the leash, veterinarians. Let's face it, we love our pets in this country. Let's put the veterinarian offices up here. Pets are part of the family too, right? They need care. Let's put them up there, but we're going to even take it a step further here. First quarter in 2016 with our telepet program. Yes, we are putting veterinarians on phone or video for you to connect for Fluffy the dog. When you wake up, you got a big meeting at work that day, but Fluffy's not feeling well, got a rash. You shouldn't have to take that dog and miss your meeting and go in and see the vet and pay that $150 average bill. Why don't you just connect real quick on the phone or video, check up on Fluffy, get some peace of mind, maybe some suggested medication potentially, right? And it just keeps you more productive, just like we do on the telehealth side for the two-legged folks. Now, apps. What do you want to do? Consult with a doctor. Maybe you want to find a provider. So instead of searching on the map, you can just pull up a list of providers here. We're going to put the top ones in here first. You can narrow the search. You want to find a pediatrician, whatever, type that in. Type search. You want to look for in-network only. We're going to help you do that. Of course, we're always merchandising our telehealth right here. Reminder, you can connect. Our doctors are waiting. But if you want to find that provider, we'll help you. Medication pricing. This is, again, one of our most popular features. Real simple. My family has not run a pharmacy claim in our plan for over 5 years. I always find a better deal on medication with this. This is cash. Let's put in amoxicillin. What it's doing is it's searching all the pharmacy locations around me, pricing multiple PBMs, finding the best price on medication. Let's say I like Target, $4. Maybe my plan copay is $20, but if I can pay cash for $4, save the $16, and I've got my next lunch covered, right? We have folks that have saving hundreds of dollars on medications because they're on an HSA. And they got to pay out of pocket, or they're on a high deductible, and they got to pay all of the expense till they hit that deductible on the medication. Well, come here first. Let's see if we can beat your plan. It's outside of the plan. It's cash. Whatever one's a better deal for you, go for it. If the plan's a better deal, great. We just validated that plan for you that you have. If our price for cash is better, awesome. We saved you some money. We kept that claim out of the health plan. Now, we're going to take it a step further. We geofenced all of the costly care centers and pharmacies. What does that mean? If you have the HealthiestYou app on your phone, you walk into an urgent care center. Let's put in a real life scenario. Let's say it's Sunday at 10 o'clock and your urgent care center is still open. You got in there. You forgot you had HealthiestYou. Well, your phone's going to beep and vibrate in that urgent care center, and it's going to say, it appears you're in an urgent care center. We want to remind you that the HealthiestYou physicians are waiting right now. You can connect right over the phone. So if there's 25 people in line ahead of you at that urgent care center and everyone's coughing and hacking around you, and you've got bronchitis coming and you know it because it's that time of year and you get it every year as the seasons change, connect with a doctor right now. So we're going to remind you at the time of need that the physicians are waiting, and maybe you can do this right over the phone. We'll do the same thing on the pharmacy side. You walk into a pharmacy, a benefit reminder pops up on your phone. Reminder, you have HealthiestYou. If you're there to pick up medication, price it real quick. Maybe we can save you some money. So we always are reminding at the time of need. Geofencing is a fun component. Saves people a lot of money. Shopping of procedures. Let's use that MRI example. The doc says, you know what, you got some weird stuff going on. Let's do an MRI. And you're on an HSA or a high deductible. And you're saying, oh, man, how much is this going to cost me? Let's say you got to do a brain MRI. What this just did is it just pinged the health insurance server that's your provider. I happen to have a United Healthcare product, so it just pinged United Healthcare as a provider. So the low, average, and high cost for a brain MRI in your area is $238, $548, and $1,019. So now I know, shouldn't have to spend more than $1,019 on this. Maybe I can shop a little bit, ask some questions, negotiate because I'm paying out of pocket. Now I'm an informed consumer and can help make some decisions around what I'm going to do for care. Check insurance. This is great. Where's your deductible stand? Well, it's synced up. If I log into myallsaversmember.com, which is my health insurance coverage, it's going to be down to the penny on my deductible. What you see here, the family deductible has been hit at my household thanks to a broken arm this summer that got us there pretty quick. Now I know where I stand. What's my coverage? When is the plan begin date? What's my copay? I'm on an HSA. I don't have any copays. But if I had copays, they're itemized right here. You know, $30 for a doctor visit, $75 for urgent care, whatever those are. It's itemized out, so you know your plan details at any time and can make decisions accordingly. Next, lastly, is your circles. This is just your shortcut to your favorites. You got your primary care that you like, specialists that you like. You keep those right in here in your circles. You can find them quickly. Same thing with the RX. You got medications you like. Put them in here. We're going to shop those medications for you all the time. If we see a price change out there, we're going to notify you. Your atorvastatin is reduced. Here's the price. Now you're going to save X amount. We're always working on behalf of that consumer. All right, well, that's it on our quick app demo. This is exciting. If you look at the stats, we just rolled this out about 120 days ago. Wow, is this driving up utilization? Last month, we had 22% of our calls come from the app, with only 6% of our entire population downloaded it yet. So right now, we're in that process of getting everyone to download it. We have thousands coming on every week. And they are shifting. This app is driving up engagement, which, what does that mean? Driving down costs for the health plan. The goal is to come back at that end of the year and say, look, great job. We've greatly reduced the healthcare costs in your plan with fewer doctor visits. They're shifting to mobile and e-visits, and we've got fewer pharmacy claims in there. So we're saving your people money, saving the plan money. That's the ultimate goal. So, okay, let's transition now. I'm going to pass this over to Tony Elder. Many of you know Tony. He's on our business development team, and he's going to talk through engagement and utilization. Then we're going to bring our special guest on, VP of Operations and CFO of a company here in Phoenix, and he's just going to tell you some stories about how HealthiestYou's impacted their company. So, Tony, welcome.
Sure. Thanks, Scott. Appreciate it. Thanks, everybody, for being on here with us. You know, all the things that we're talking about are great. You know, they're fun. We have some great tools, and the theory behind our app is to, number one, drive engagement, but through keeping people thinking about HealthiestYou first. So we've done a great job of mixing in on a high level pretty much everything across kind of the healthcare spectrum of your daily life. That all being said, as Scott kind of just mentioned, we've only had the app out there for about 120 days. So pre-app, what we were doing was driving utilization through customized campaigns, and I'll get into that. But at the end of the day, if people aren't using the benefit, what's really the value in it? So the number you see in front of you, the kind of the bar graph here, we hit 42% utilization in 2014 with no app, without anything approaching the technology that we have today. In 2013, we were just under 40% at 39.75. Our industry has really struggled to generate utilization. One of the things Scott actually referenced was kind of first call syndrome. What we've tried to reduce or remove with the way our structure is, why not try HealthiestYou first? And we've been very successful at presenting our program that way to our groups as well as their members. Again, the industry has averaged under 5%. Our biggest competitor in the marketplace actually just had an IPO this summer where it showed in 2014 that their utilization was actually under 4%. So with the way we measure it is relative to the number of employees versus telehealth consults every single year. So across our wider book, we average 42 visits for every 100 employees on the program. Our team here in North Scottsdale, they're in the next room for me and Scott, really just doing everything they can right now to reach our 11-1 groups, just welcome them on board. Thank you for purchasing HealthiestYou, understanding why they made the decision to buy HealthiestYou, get them out the relevant collateral that they need around their office, in addition to maybe a poster and some flyers. How can we customize a campaign, a strategy to communicate to your employees to engage them with HealthiestYou? We have a really tech-savvy group up the street here in Nevada that actually has a wired campus, if you will. Well, they have a couple of movies that play on a loop in their restroom at their office. So every time their employees are going into the restroom, they're being engaged with HealthiestYou, if you will, and their utilization is absolutely fantastic. Down the street, we have an airline, but by definition, that same strategy would never work, because their people are never in the same place at the same time. So it's more of a traditional marketing campaign. Key fobs, magnets in the cockpits and the galleys of the airplanes, and kind of dripping on them every single month. And when appropriate, they think about HealthiestYou first. Our team does a great job of engaging at the relevant time. You won't see content from us about flu season in the middle of June, right? We want to hit it when it's relevant with the member. Part of our engagement strategy is to send out a fulfillment kit. Typically, will arrive maybe a week to 10 days after a group comes on board with HealthiestYou. Obviously, the earlier we get that file in, the sooner we'll get this type of content out. You absolutely don't need this card to utilize the benefit. Everything is kind of virtual with HealthiestYou. This is really just a marketing piece that we try and get to maybe the spouse and the dependents to get them to start asking questions. And there's even a card that you can stick in your wallet or put on the refrigerator as well. Our team does some great campaigns throughout the year. My favorite one is the one you can see all the way on the right-hand side of the screen. We worked and put the top 32 acute issues that we treat every single day on an NCAA tournament bracket. And the subject line was, "Let HealthiestYou be your bracket buster this March." So that's what I mean when I say relevant content, right? You're not going to see, guys, gals in lab coats with stethoscopes around their neck saying, "Feeling sick, call HealthiestYou." So we had the NCAA tournament pool or bracket play out. Allergies was the big winner. There was a short video from Dr. Kelly Traver, our chief medical officer, about allergies. It also had the relevant website, phone numbers. It's trying to be fun outside of the box to continue to engage with our members. We'll send out some relevant collateral as the offering updates, as obviously it's doing quite a bit lately, and as Scott kind of alluded to, some of the initiatives we have coming in the beginning of 2016, whether it's pet care, couch care, some of the other stuff that we're going to do with wearable devices. We also want to stay engaged with our administrators. We have, for instance, just launched a brand new portal that has the ability to actually show you where you're doing visits as a group, where your folks would have gone based upon survey results, if not for HealthiestYou. We just pulled up what you can see in terms of a transparency product for your group. So you can see the number of employees, the number of consults they've done this month, quarter, where they told us they would have gone if not for HealthiestYou, primary, urgent, ER, primary care, urgent care, ER. We also can show you the time of day that the employee called in, the top 5 complaints, top 5 locations, right? So maybe you have a manufacturing facility in Oklahoma, a satellite office in Texas and Louisiana. And Texas and Louisiana are doing a great job of consuming HealthiestYou, but we need to focus our communication strategy on the people in Oklahoma. So we can provide that data, basically in monthly it updates, but in real time you can see, as the group goes through the natural course of the year, how it's performing. And by no stretch of the imagination are we perfect. We can adjust course. We just don't want to be in a situation, nor do we see ourselves as the type of company that sends you out a poster, shakes your hand, wishes you luck, cashes your check, and then 8, 9, 10 months later we're wondering why utilization isn't where it is and why a group might not be renewing with HealthiestYou. So this is a case study. Blue-collar manufacturing company actually out of Ohio. They joined us after removing their incumbent telehealth provider for 2 years, where they saw no difference in their claims redirection. They partnered with us and they put together a strategy of changing the plan design of their healthcare. The plan design change, implementation of HealthiestYou actually led to a 37% decrease in the number of folks that filed a claim, 39% decrease in the actual number of claims. We saved this group $31,000 roughly annual hard dollar claim savings by redirection, plan design changes. We cost the group about $15,000, a net savings, a net ROI, if you will, in year 1 of almost $16,000. Just a great story. Hardly any technology involved here, right? This is all pre-app. Just as importantly, I would argue 2.2 fewer PTO days per employee. To go back to Scott's earlier point, we're removing every barrier to accessing care with HealthiestYou. There's no cost. There's no reason to wait. There's no reason to get your coworker sick. excuse yourself, spend the 20 to 25 minutes that it might take from soup to nuts to take that doctor visit and pick up that script during lunch or on the way home, and you're back functioning at a very high level next day. This is a school district actually that came to us with a great story. They're out of Wisconsin with about 225 employees enrolled on the program. The plan around that. The major medical, it's a great time whenever you're implementing HealthiestYou, maybe to switch over to a PPO from an HMO, or to go fully insured to self-funded, make some other types of plan designs. The idea of HealthiestYou in presenting the benefit to an employee that, hey, you're going to have access to a doc 24/7, 365 at no cost, can change the entire tenor and tone of an open enrollment meeting. I think anybody that watches the news today knows that the renewals might not be that great, but it's a great strategy to try and change the way people are perceiving their change in benefits. So we welcome being partnered in and being brought in to kind of talk about the net gain that the employee is going to see. And obviously you can open yourself up to selling some other maybe ancillary products. We have some great partners that sell gap plans, some of the critical care accident plans, and obviously looking at plan design, you can fill out your plan and maybe offer some other types of benefits as well. This is our pricing in the small group setting between 2 to 99 employees. When the employer is making the investment in the program, we're at $9 per employee per month. As the group size scales up, and this is again based upon the number of employees enrolled, between 100 and 249 employees, it's 8, 250 to 499, 7, between 5 and 1,000, it's 6. And anything over 1,000, we really want to talk through. We do have the program available on an individual and a voluntary basis as well. In those instances, the pricing is tiered. So instead of it being $9 and on the employer paid side, whether I'm a single employee or am married with 14 children, on the voluntary side, it's $11 for an individual or $15 for a family. And obviously, these price points include absolutely everything that we're doing today within HealthiestYou. There's no fine print written in there that you can only use the benefit so many times. It is truly a membership-based type program, and just like a gym membership, the more you use it, the more value you're going to see yourself get at the end of the day. So with that said, I'm going to wrap up my side and bring in Fred Johnson, the VP of Operations for Team Select Home Healthcare and CFO here in Phoenix. He's been our client for about 3 months with Team Select. He also has a second company, House Boxing, that is a client of ours as well. So Fred, welcome. Can you hear us? Still
yeah, I can hear you perfectly.
Sounds great. So
yeah.
I guess if you wouldn't mind, just to lead off, if you just let us know what your thoughts are and what your experience has been.
Yep, that sounds great. So hello, everybody. I just want to say, first of all, that I'm, completely unaffiliated with HealthiestYou, other than being a customer, just like some of you are. I'm getting nothing out of this today, other than I feel a huge debt of gratitude to HealthiestYou for what they've done for our company already. So I jumped at the chance when Tony asked me to speak about our experience. Just a little bit about the company here. We're about a $40 million company with locations in Arizona, Colorado, and Oklahoma. We've got about 750 employees, but only about 150 of those are full-time benefit-eligible employees. The rest are, since we're a healthcare company, the rest are therapists and nurses who work for us on kind of an as-needed basis. So most of them don't go over 30 hours a week. So when I first learned about HealthiestYou a little over 3 months ago, it was honestly like probably one of the biggest no-brainer decisions I've ever seen or encountered in my 20-some years of managing businesses. It was about a 30-second decision or sell to our president to get the go-ahead to do it. And I think it was about 3 days from when we said yes to Tony, that him and Blake Johns, who was our HealthiestYou implementation coordinator, until we had the whole thing launched. So literally from like learning about it to launched to our employees, it was about 3 days, and it was just easy. We scheduled like 2 webinars. Probably only half the people attended because they really didn't know exactly what we were doing. Yet everybody was able to adopt it, download the app, and start using it right away. So for us, they talked a lot about the benefits, and I can tell you, in even just 3 months, there's nothing that the HealthiestYou folks talked about today that isn't completely and 100% true. And to me, it still seems too good to be true. For like $9 a month, you get all this, but it is. So for us, we are definitely expecting that our claims will go down. So we have United Healthcare. Clearly, less people are going to go to the emergency rooms and clinics and doctors because they are using HealthiestYou. So when it's time to renew our health plan next year, we definitely expect our rates to go down, or if the national average goes up 10, maybe we'll only go up 2%, something like that. We've only been on it for 3 months, so it's a little bit soon to tell, but we actually, I think the national average was about 8% increase in health benefit costs for employers this year, and we kept everything the same. And we're going in at break even. So I can't really say that HealthiestYou played a huge role in that yet, but I definitely don't think it hurt, and I think it will help a lot next year. But I'll be honest, like the biggest reason we're doing this is employee engagement and retention and retainment. So yes, we're also going to get less sick days. People will miss less time from work, and that's great too. But for us, our kind of silent killer in the healthcare industry is turnover, and so turnover costs us a ton of money. It's hard to calculate, it's hard to point to, but when it comes to training and onboarding and recruiting and headhunter fees and all that nonsense, if we can find the best people and keep them on longer, and keep them from leaving and keep them engaged, then that saves us way more money probably than these other costs that the HealthiestYou folks have been talking about, and even though those are real too. And I can tell you that our employees love HealthiestYou. And it is not just a retainment strategy for us, it's a recruitment strategy, because what we're doing is we've rolled it out to all of our benefit eligible employees, so like 200 or so of our 750 employees. We rolled that out 3 months ago. But coming up with open enrollment, we're rolling it out to all of our employees, even if those employees only work 1 month or 1 hour a month. So these are folks that don't work at least 30 hours a week. They work for us kind of as needed. You can call them temps, you can call them interns, we call them PRN status, which basically means like as needed employees. We haven't decided whether we're going to do it for free, just as a tool to say, hey, we appreciate you, we like you working for Team Select. Our competitors don't offer you this, and we're going to offer this to you for free. Or we might just say, you know what, we're gonna take out $9 a month out of your paycheck through direct, just automatic deduction, and they'll look at that and be like, wow, you mean I can get free telehealth, unlimited calls, I can call a doctor whenever I want, not just for me but my whole family, and I can get cheaper prescriptions, and all for only $9 a month. Like, sign me up. They're going to think we're paying thousands for this on their behalf when we're paying like $9 a month. So that's our plan coming next. I can definitely tell you it is so easy to use. It really took like no training at all. We also, as Tony mentioned, I'm a part owner in a boxing gym, and we have about 8 trainers. So small company, and we rolled this out to them, and they just think that me and my partner, my buddy, we're the best owners on the planet, because they're contracted employees, they're 1099 contract employees, they're not full-time employees of the gym, but we're covering their health benefits now with HealthiestYou. Of course, it's not the same as a full health plan, but it's pretty damn good. And these trainers now will probably never leave us, because I don't think any other small boxing gym in the Phoenix area is going to have the foresight to offer something like HealthiestYou to their contractor employees. So that's been a huge success for us as well. So I'm sure hopefully there'll be some questions and stuff, but honestly, I don't have much of a filter, and I would just kind of say, like, if you even have to think about this, then I'm not sure you belong running a business, because it's probably the biggest no-brainer that I've encountered in 20-some years of managing businesses. It's just, if you even have to do an ROI or think about it, you probably don't have a lot of business sense. It just makes every sense in the world.
Well, Fred, I just let Tony go on the sales side, so you're hired. So thank you. But it was a very, very thorough overview, and much more in depth and complimentary than we had expected. But I think it was very helpful, maybe for the folks that have dialed in, to just hear how that experience has gone for you, both as a business owner and a numbers guy on the CFO side, and operations guy who is very passionate about taking care of our employees. I think there's a strong message there. So we greatly appreciate you taking time out of your business.
My pleasure.
Yeah.
My pleasure.
So we appreciate that. And I think, boy, we had a few questions we wanted to ask you, but you were so thorough. You've addressed all of these. So I think we can probably wrap up your section, Fred. Again, thank you so much. And we'll jump back to the call here, and based on some of the questions that have come through on the chat box, I think what we'll do next is jump to our ROI kind of value savings analysis system here, which is great to show what this means on the financial side. So what does it mean when you redirect claims? Okay, so we'll run through a little scenario here. This is kind of our savings calculator that is accessed by our employee benefits specialists, and we can do here at HealthiestYou to say, if I have X utilization, what's that mean to me as a company? And it's designed primarily for self-funded groups, but if you are fully insured, it's still a great exercise to run through, because it can show you how the dollars are shifted out of even that fully insured plans, because we all get together and take this HealthiestYou and embrace it. We won't have to deal with those increases that we're seeing every year. So let's run a scenario. Let's say you have 1,000 employees at the company that are benefit eligible, and let's put together a kind of a custom price point. We'll run this, you know, on the high side. We'll put it at $6 per employee per month, and it's going to cover the family. And we'll just use some industry average figures here. Let's say you're doing 3,500 primary care visits a year, and you're doing 1,100 urgent care, and we'll say 750 emergency room visits. And again, let's look at the average cost if your employee was to go to the primary care, and we'll use average figures across the country. 125 is probably a little bit low. We'll say 175 on the urgent care, and ER will run at 1,100, which is probably more around 1,300. But let's say we can redirect 10% of those primary care, urgent care, and emergency room visits to HealthiestYou. So they're going to call, they're going to get their issue resolved and not have to go in. So you've got 1,000 insured. You're doing about 5,350 total visits broken down by doctor, urgent care, and emergency room. So we'll be doing about 535 visits a year with HealthiestYou. So you're spending $72,000 for the year for HealthiestYou, and this is kind of what Fred's getting into. You know, it's when he's saying that he's a numbers guy. The value, the perceived value from the employee side is so high versus what you're actually paying. But then on the redirection side, if you can redirect 10% of those claims, you can save $145,000. So you're spending $72,000 to save $145,000 in this scenario at a 10% redirect rate, about a 50% utilization, which is very common in an average in our self-insured book of business. Massive ROI to be experienced there. Now, we haven't even talked about the absenteeism yet. So as Tony showed you in that case study, absenteeism is reduced many times with what we hear from our HR directors. Productivity is increased. The environmental impact for those of us out there that are concerned about the environment, average trip to a doctor is 16 miles. Okay, with a 2-hour wait, look at the fuel savings and the CO2 footprint savings. You don't need to drive anymore. You can stay at the office, you can stay at home or your hotel room and get that issue taken care of. So there's incredible savings there. And you can go back and say, you know what if this group can only do 5% redirect? Let's say they're an underperforming group in our book, and they're only going to do 268 visits. Well, way underperforming, you're still breaking even. You're saving, look at, you're spending 72 and you're saving 72,750. So this benefits for free. And you're still reaping the benefits of the absenteeism and the productivity and employee morale and so on and so forth. So this tool is just helpful. If anybody on the phone would like to have one of these done for their company or for a prospect or a client, just contact us. You can contact us here on the HealthiestYou website. Just put in here the, actually you have to go to the bottom, I believe, here. Get in touch, HealthiestYou. Here's our phone number, our email, support@healthiestYou.com. Phone number is 480-779-4360. We're happy to run a financial scenario, answer any questions you have, and get you any information you have to make that decision. All right, well, there's just a couple of questions we can touch on quick. We're getting close to the hour here, 4 minutes. Does this plan have to be offered to COBRA folks? That's up to you, how you want to structure that in regards to ERISA and COBRA. We have companies that do it either way. That is a ERISA-sponsored plan. It can be portable on our side, so if that employee is leaving, they can certainly take HealthiestYou. We can deduct the payment on that via a credit card or ACH, so that's certainly easy to accommodate. Do we do anything on the advocate side, so helping negotiate or navigate bills? Today we don't. We used to have an advocacy program built in to our offering, and frankly, the utilization was very low on it. It was a great product, but utilization was low, so we decided a few years ago actually to pull that out and kind of simplify the message. So today we do not have that. Do you offer these services and app direct to consumers? So we have a voluntary and an individual offering, so a non-group offering. So yes, if you have a neighbor or somebody you know that would like the HealthiestYou membership, could benefit from that, we can certainly get you set up on an individual or family membership outside of the group. There's a question here, is video offered in Texas? Video is actually not offered in Texas due to the state regulations. It's phone only today in video. Let's see here. Any other questions? I think a lot of these have been covered. Can you model a savings potential for a prospect? We just went through that. Is this webinar being recorded? Yes, it's being recorded, and it will be emailed back to all attendees and all folks on the invitation list. If you do want to request a copy, again, you can email us, support@healthiestYou.com, or call us. All of our information is at healthiestYou.com on the website. We'll be happy to get you any information that you need. And I think we've pretty much covered it, and we're right here on the hour. So again, I want to thank everybody for joining. I hope this call was helpful and valuable for you, taking an hour out of your day. I want to thank Fred for joining us and all the positive comments he mentioned there for his company at Home Healthcare and the House Boxing. And thank you all for joining. We greatly appreciate you, and we look forward to working with you if you're not working with you today. And for those of you we have the pleasure of working with, thank you. And everybody have a great rest of your week and a great holiday season here coming up. Thank you so much.